Hello, my name is Jordan. I am a graduate student at Cal Poly Pomona in the Kinesiology and Health Promotion Department. Today I will be presenting a study that I wish to propose as my master's thesis. I will be conducting the study with the help of my research chair, Dr. Srdjan Lemez. This study is important to me because growing up I played football and had a few concussions and bell ringers as they called them, and I felt it had an effect on my early college experience, which is loss of focus and loss of sleep. And today I will be talking about examining the relationship between concussion incidence and mental health in active collegiate athletes. What is a concussion? Well, according to Gutenberg and colleagues, concussions are recognized as traumatic brain injuries resulting in temporary neurological impairment caused by biomechanical forces after a direct or transmitted blow to the head. The CDC reports estimate that 3.8 million sports and recreational concussions happen annually. Some may experience persistent post-concussive syndrome. According to Nowak and colleagues, approximately 2.5 million high school athletes and college athletes engage in contact sports. Long-term exposure to these head impacts is suggested to increase risk of development of CTE. Mental health risks with traumatic brain injuries have been a mainstream topic lately. Anxiety, depression, and sleep disturbance have been linked to sports-related concussions. In the United States, 21% of all adults was reported to have mental health illness, according to the National Institute of Mental Health. Collegiate sports have a high participation rate in the U.S. Given the high stress on student athletes, there is a surprisingly limited amount of research studies that examines the relationship between concussion incidence and mental health in student athletes. The purpose of the proposed study is to examine the relationship between concussion incidence and mental health outcomes in student athletes' participation in the NCAA Division II sports. It is important to study this topic so that student athletes can make informed decisions about their mental health. We chose soccer because soccer is the most popular sport in the world with an estimated participation rate of 265 million people. According to Rodriguez and colleagues, concussions make up to 22% of all soccer injuries. For study design, we chose a qualitative phenomenological study design to gather data. We chose this study design so we can understand the student athletes' lived experience with concussions and mental health risks. For sampling, we will use a convenient sampling technique at Cal Poly Pomona. We chose this sampling technique because of the timetable for the study and because my master's thesis will be completed at Cal Poly Pomona. We will recruit 10 to 15 active men's and women's soccer athletes. We chose 10 to 15 because we feel as though we will reach saturation with that number of athletes, and we chose soccer athletes because it is a sport at the school which has the highest rate of concussion incidences. To recruit the soccer athletes, our first contact will be through email by the completion of the spring 2022 semester, when we receive ethics approval from the institution. The email will contain a brief description of the nature and rationale for the study, as well as an invitation to complete a pre-participation survey. The participants will be sent a link to a website called SurveyMonkey where they can complete the survey. The pre-partition survey will determine whether the student athletes meet the pre-established inclusion criteria. The main inclusion characteristic will be history of diagnosed or self-recalled concussions. Once we have screened and selected all participants, we will have them sign a participation waiver. Data gathering will be done through several methods, including individualized, semi-structured interviews, and questionnaires. One of the questionnaires used will be the Patient-Reported Outcomes Measurement Information System 29, also known as PROMIS 29. It will ask questions such as, have you felt uneasy? Have you felt worthless? And to rate a participant's sleep quality. The PROMIS 29 is a questionnaire that measures several domains, including mental health and physical function. We will use the PROMIS 29 to measure depression, anxiety, and sleep disturbance. After the data is gathered, we will analyze it with a data analysis software called NVivo. NVivo software will be used to keep track of all our data and change it into a form we can visualize as researchers. All interviews will be transcribed and coded. The interviews will be transcribed and coded by 2 researchers and compared for any mistakes that may have been made during transcription. The transcribers will be using verbatim transcription to write down every word, sound, and pause a participant makes during the interview. Although we don't have a hypothesis for this study because this is a qualitative study, other studies have shown there may be a link between concussions and mental health. Studies on professional athletes in high collision sports have shown mental health issues in retired athletes. This study has a potential significance on mental health for student athletes, and we anticipate that the study will provide meaningful data for sports. Relating to the association between former concussions and mental health in student athletes. Although the link between long-term health and concussions has received mainstream attention in recent years, mainly through the NFL and the prevalence of CTE in former players, there is a lack of high-quality studies in soccer. This is concerning due to the high participation rates globally and the high reported concussion rates in the sport of soccer. Student athletes' mental health is important. We hope the study of this caliber will illuminate the importance of mental health services for student athletes. Providing meaningful data for a student athlete regarding concussions and mental health will provide student athletes the information they need to take a proactive measure to mitigate the long-term negative impacts of concussions. I would like to thank everybody who came to the conference and watched my presentation today. If you have any questions regarding any of the information I said today, you can email me at jordanh1@cpp.edu. I am happy to answer any questions, as well as if you have any feedback, please email me so it can help me with my study. And I would like to thank the International Organization for Health, Sports, and Kinesiology for allowing me to present my study here today. And I would also like to thank the organizers for picking my study. I appreciate everything you have done for this organization, and I am happy to be a part of this conference. It was a first time doing this for me, and I want to thank you all for allowing me to present. Thank you.